The most outstanding Chinese medicine for cancer treatment, Professor Chen Hailin. Cancer is a world-class problem. When it comes to cancer, the first thing that comes to mind is death. Cancer is known as a world-class medical problem because of its drug resistance, easy metastasis, and easy recurrence. Throughout the ages, medical scientists have never stopped researching cancer, but they have never been successful. It is not uncommon for people who study cancer to die from cancer. Western medicine is the mainstream of anti-cancer, but Chinese medicine handed down from the Chinese ancestors should not be underestimated. Therefore, there are many Chinese medicine practitioners who do not care about fame and wealth, and treat low-key people in a low-key manner. And Chinese medicine Professor Chen Hailin is one of them. In recent years, the morbidity and mortality of tumors are on the rise worldwide, and the mortality of malignant tumors has become the first cause of death for residents worldwide. Cancer is a disease that is difficult to treat at the current medical level. The reason is that the cancer does not have any symptoms in the early stages, and most patients are found at an advanced stage. Once many patients suffer from tumors, they feel that, and quote, the sky is falling, and quote, life is hopeless, end quote. The appearance of Chen Hailin brought hope to the majority of cancer patients. In more than 10 years of medical career, Professor Chen Hailin has always adhered to the road of fighting cancer with traditional Chinese medicine. For thousands of years, Chinese medicine has been closely related to the reproduction of the Chinese nation. It is not only an outstanding advantage of the Chinese nation, but also a treasure of world medical culture. In order to promote the development of traditional Chinese medicine, it demonstrates the dual strength of Chinese culture and technology, and also enhances people and APO's recognition of excellent traditional culture. Feel. And quote, Chinese medicine is the quintessence of the country and the treasure of the Chinese nation. It is a glorious mission and a great responsibility to develop Chinese medicine. It has a good reputation in the eyes of patients. It is the belief in life that it has cured patients all over the country and defeated various cancers. The support and progress of Chen Hailin all the time, no matter how the stages and occasions of life change, this belief is always the same. Over the past 30 years, Chen Hailin has treated thousands of cancer patients, many of whom are poor and cannot see a doctor. Nevertheless, Chen Hailin did not give up on them. Sometimes he preferred to treat poor patients at his own expense. Zhong Junping, male, 71 years old, military doctor, Building 14, Pinqing Garden, Shu Street, Hongshan District, Wuhan City, Hubei Province. He was diagnosed with me on April 23, 2020. The patient suffered from sequelae of recovery from the new coronavirus. The main complaint was that the patient found that he had chest tightness, tightness of breath, shortness of breath, and upset, which had worsened in recent days, and had irritability. History of current illness: the patient developed cough and chest tightness on January 17, 2020. On January 18, 2020, he was admitted to Zhongyan Hospital of Wuhan University, T-Lung plus mediastinum, plain scan, MPN, no, P05595535. The patient developed dyspnea and dyspnea 1 week after the onset of the disease. Hypoxemia and acute respiratory distress syndrome may occur. Transfer from the infectious disease department to the respiratory ward for treatment. On the basis of symptomatic treatment, we should actively prevent and treat complications, treat basic diseases to prevent secondary infections, and provide timely organ function support. Emergency measures were taken, including oxygen therapy, adequate fluid resuscitation, improvement of microcirculation, use of vasoactive drugs, and hemodynamic monitoring. With the active treatment and emergency rescue by doctors and nurses, the condition was finally cured in 20 days. Improved and gained hope of survival. In response to the order of the emergency command, he was transferred to Taikang Wuhan Hospital for treatment on March 11. On March 13, 2020, Taikang Tongji Wuhan. Western medicine diagnosis: 1. Emphysema. 2. Chronic bronchitis combined with emphysema. 3. Bile disease. 1. New coronavirus pneumonia. Recovery period. After treatment in the hospital, my symptoms now include wheezing, rapid heart rate, lack of energy, muscle atrophy, general weakness, and poor diet when walking and sitting despite deoxygenation. Feedback at 17:57 p.m. on January 15. I don't have enough breath to speak, I lose oxygen, and I feel flustered and short of breath after being unable to speak for a while. Had a remote consultation on April 23, 2020. Symptoms: thin body, original weight was over 180 kilograms, current weight is over 140 kilograms, pale complexion, chest tightness, shortness of breath, difficulty breathing, palpitation, dizziness, loss of appetite. Dialectical, deficiency of both qi and yin, excess heat in the internal organs, poisonous preserved meat, and excessive body fluids. Loss. Treatment method: moisten the lungs and kidneys, increase clearness and reduce turbidity, replenish body fluids, strengthen the stomach and strengthen qi and nourish blood. Follow the instructions above, pay close attention to the pathogenesis, and start taking medicine on April 23. Until June 17. End quote. After active treatment by multiple hospitals, the patient and APO's immune system was recovered. All examinations were in compliance with normal standards and he recovered and was discharged. However, from the perspective of imaging, there are still obvious symptoms of the disease. Symptoms: 1. Diffuse, interstitial, fibrous, and cord lesions still exist. In addition, the three major sectors of respirators carrying oxygen day and night are all medical problems so far, and they are caused by the new type of coronavirus pneumonia. Liu Muxu, male, 57 years old, is a bricklayer, construction worker, in Ziliu Village, Luqing District, Chengzhou City, Shaanxi Province. Lung cancer, multiple nodules in the upper lobes of both lungs and the lower lobe of the left lung. The patient was at a high-altitude construction site when he suddenly felt chest tightness and difficulty breathing. Along with coughing, there was blood in the sputum. He immediately rushed to the nearest Shaanxi Hospital. According to the CT examination report, multiple occult nodular metastases were scattered in both lungs. The hospital recommended, go to Chengzhou Hospital for radiotherapy and chemotherapy. The spiral CT examination report from Changzhou People and Apo's Hospital on August 14, 2009, multiple hidden nodules scattered on both sides of the lungs with rough edges, the largest of which was about 1.5 centimeters. After the examination, the director of the radiology department of the hospital and the patient were from the same village. He immediately conveyed to the patient and Apo's family members that he should be treated as soon as possible. The family members asked how long it would take to recover. The doctor said that radiotherapy and chemotherapy could take up to 8 months. The family members asked again, after 8 months. The doctor said, usually it doesn't last that long before the person passes away. Later, the patient and Apo's family spent 2 months traveling around to inquire about hospitalization and treatment, and the information they received was the same as before. When he was unable to seek medical treatment, his relatives and friends in the same village recommended Professor Chen Hailin to the patient. On November 18, 2009, the patient rushed to Professor Chen Hailin for consultation. Symptoms: weight loss, cough, blood in sputum, swelling and pain in the chest and ribs, difficulty breathing, especially paroxysmal at night, sleep, night sweats, gastritis, ulcerative gastritis, thick and yellow tongue coating, thin and stringy pulse. After a series of tests, Chen Hailin prescribed herbal decoction to the patient. After 7 months of traditional Chinese medicine treatment, the patient felt good about himself. Interventional treatment with pure Chinese medicine started on November 18, 2009. After 7 months of clinical observation, I felt good after taking it. I checked at a local hospital and found improvement compared to before. At this time, the patient stopped taking the medicine and began to return to work in Murakami. Until November 3, 2010, the patient underwent CT examination at Hejia Hospital affiliated to Changzhou Medical College. The examination and diagnosis report was, the chest corridor was symmetrical and full, the shadow of both lungs did not increase significantly, and the left lung nodule was small compared with the previous film. The lesions shrank and the symptoms of emphysema in both lungs disappeared. It has been 13 years since the examination on November 3, 2010, and I have not had any physical discomfort and have not had any examinations. Liu Haixu and Apo's lung cancer has not metastasized or recurred since she was treated with traditional Chinese medicine in 2009. Follow-up in March 2022, the patient is in good health and has never stopped doing physical labor in the past 13 years. Return to normal life. Xu Kai's, female, 54 years old, lives in Tujiao Village, Huangyudi Township, Luqing City, Shaanxi Province. I went to see Professor Chen Hailin on January 5, 2016. Main complaint: the patient and Apo's lower abdomen and bladder area dropped. The falling has worsened recently and the pain has worsened recently. History of current illness: I underwent uterine cancer resection at Heping Hospital affiliated to Changzhou Medical College on February 25, 2015. I underwent postoperative radiotherapy and chemotherapy for 6 times. After the end of the period, the condition was relatively stable for 2 months. In October, I suddenly discovered swelling in my lower abdomen. On October 21, 2015, a magnetic resonance imaging examination was performed at Haping Hospital affiliated to Chengdu Medical College. It showed localized nodular thickening of the anterior wall of the cervical canal, with a slight wavy change at the edge. There are a few cords around the cervix and the bladder is smooth. Check-up opinion: cervical cancer. Inpatient clinical observation and comprehensive treatment, physiotherapy and drugs on October 22, 2015. After nearly 2 months of treatment, I felt that my lower abdomen was sinking, stuffy, sleepy, and painful. Requesting an examination, a magnetic resonance imaging examination, at Haping Hospital affiliated to Chengdu Medical College on December 2, 2015 showed that after hysterectomy, the vaginal stump nodule was thickened and the boundary with the posterior wall of the bladder was unclear. On October 21, 2015, comparing the daily pelvic images, the lesion shrank. The morphological signal of the rectum was normal, and there were no abnormal soft tissues and no lymph nodes in the pelvis. Diagnosis: 1. Cancer after hysterectomy. 2. The vaginal stump is abnormal and the posterior wall of the bladder is invaded. 3. The bladder and rectum are invaded, and the bladder and rectum are still metastasized after postoperative radiotherapy and chemotherapy. After the examination, my family are requested to take traditional Chinese medicine for treatment and came to the hospital for treatment on January 8, 2016. Weight loss, pale complexion, indigestion, sagging lower abdomen and bladder area, difficulty squatting when urinating, holding back, stuffiness, swelling, sleepiness and pain, frequent dry stools, frequent urination and hematuria, red tongue with sticky coating, sublingual varicose veins, thin and stringy pulse. Inflammation, damp heat causes hemorrhage, blood stasis leads to purpura, damp heat accumulates poison and burns the blood collaterals. Treatment method: dry dampness and remove stasis, clear away heat and diuresis, dissipate stagnation and reduce swelling, replenish qi and blood, pay close attention to the pathogenesis, follow the above instructions. After more than 5 months of treatment with more than 60 Chinese medicines, the patient felt better than before. The lower abdominal prolapse was significantly improved, the stool was normal, the urine was clear and painless, and there was no hematuria. Red tongue with thin white coating, thin and slow pulse. I requested to continue treatment, and after 3 months of careful treatment, I stopped taking the medicine on December 30, 2016. I took more than 80 pairs of Chinese medicines in total. After stopping the medication, clinical observation was conducted and a magnetic resonance imaging examination at Haping Hospital affiliated to Chengdu Medical College on September 6, 2017 showed that there were no abnormalities in the uterus. After more than 9 months of taking it and careful treatment with multiple drugs, the patient felt his symptoms were good, and the above-mentioned symptoms were basically effectively controlled and cured. Wang Huiqing, female, 45 years old, an employee of Chengzhou Huaihai factory, came to see a doctor on April 12, 2009. Main complaint: I have been suffering from choriocarcinoma for more than half a year. Due to excessive bleeding, my condition has worsened recently. History of current illness: I have been a hepatitis C carrier for more than a year, with liver cirrhosis and splenomegaly for more than a year. I have suffered from hydatidiform mole and dilation and curettage for more than half a year. I have irregular vaginal bleeding that is more and more frequent, and the bleeding varies with blood clots. I received Western medicine and traditional Chinese medicine in the local hospital. The combined efficacy is poor. Recently, I suddenly experienced severe pain in my lower abdomen and immediately underwent gynecological dilation and curettage in the hospital. In order to further clarify the condition, a spiral CT examination was performed at Shanxi Cancer Hospital on April 10, 2009. Scan area: whole abdomen. Mode: plain scan plus enhanced scan. Review of choriocarcinoma. Abdominal CT scan shows the surface of the liver was not smooth, the density in the liver was not uniform, and no abnormalities were found in the liver parenchyma. Impression: liver cirrhosis, splenomegaly, slightly thickened cardiac wall. Please combine with microscopic examination, nodular low-density lesions in the uterus. Consider the formation of uterine fibroids. The patient is emaciated, pale complexion, dizzy, swollen lower abdomen, poor energy, lazy to talk and short of breath, indigestion, insomnia, nausea and vomiting, pale tongue with white coating, irregular vaginal bleeding that varies in duration, and a slow pulse. Late and thin. Follow the instructions above, pay close attention to the pathogenesis, and observe closely. Dialectical syndrome, liver qi stagnation, Chong and Ren deficiency, spleen deficiency, kidney deficiency, and body fluid loss. Function: regulates qi and relieves stagnation, regulates Chong and Ren, strengthens the spleen and kidneys, and replenishes body fluids. After more than 2 months of careful treatment, my appetite increased and my dizziness was relieved. But other symptoms were not obvious yet. After 3 months of follow-up care and treatment, the patient and APO's complexion became rosy, her lower abdomen sank, her vaginal bleeding disappeared obviously, and she slowly began to get out of bed and move. While consolidating the course of treatment and increasing intensity, and after nearly 4 months of careful treatment, the test indicators for hepatitis C, liver cirrhosis, and splenomegaly were significantly close to normal, and the patient and APO's weight increased from the original 95 kilograms to 118 kilograms. Move freely, often go out to exercise and maintain housework. After 9 months of careful care and treatment, all the above symptoms disappeared. It has been 13 years since April 12, 2009. During these 13 years, the patient has lived a healthy life. It is difficult to describe in words how excited he is. It has been 13 years since Wang Huiqing and Apo's choriocarcinoma was cured by traditional Chinese medicine. After a one-time cure, there has been no recurrence or metastasis for 13 years. His brother-in-law was followed up on September 9, 2022. He is in good health, engaged in housework, and raising children. I wish her good health and a peaceful life during this Mid-Autumn Festival. Rom Kunzwo, male, 63 years old. Peripheral lung cancer in the left upper lung. On April 11, 2006, I had a CT examination at the Chinese People and Apo's Liberation Army General Hospital in Beijing. After the patient and Apo's examination, the family requested surgical resection, and the hospital, based on the patient and Apo's underlying disease, was more complex: cerebral infarction, hypertension, heart disease, old tuberculosis, prostate hyperplasia, insomnia, and diabetes for more than 20 years. The hospital recommended conservative treatment and did not even prescribe chemotherapy drugs, but politely declined. I came for treatment on July 4, 2006. I was emaciated, pale complexion, coughing every day recently, chest pain, blood in sputum, indigestion, pale tongue with thick and greasy coating, and deep, thin and stringy pulse. Treatment with traditional Chinese medicine from July 4, 2006 to mid-December 2006. The patient felt good about himself and underwent a CT scan at Jinqing Mining Bureau General Hospital in mid-December. Tiny nodules were formed and old calcifications of tuberculosis were seen. There was no abnormality in both lungs. After nearly 5 months of careful observation, we have achieved satisfactory results. She stopped taking traditional Chinese medicine due to severe diabetes and heart disease. Even in the years to come, I kept in touch with the patient himself, and he recommended me to come for treatment when he was seriously ill. According to a friend of the patient, he was discharged after 2 days of emergency treatment at Heping Hospital affiliated to Chengzhou Medical College due to diabetes and uremia. The patient was cured clinically with traditional Chinese medicine and survived for 5.5 years without recurrence or metastasis. It was years of diabetes complications that took away his life. In the difficult years, Chen Hailin experienced too much. In a summary, 90-9 sweat, a point inspiration, more than 40 years of realization. Professor Chen Hailin has developed thinking and imagination of thinking and imagination from multi-layer, multi-system, multi-directional, multi-dimensional roads and multi-channel thinking. Based on the combination of traditional culture and quote, transformation books and quote, the combination of and quote, 5 elements and quote, and Qigong, Yang and Yang, and nourishing disciplines. Under the guidance of traditional Chinese medicine, the three-focus gas theory is organically combined with the diagnosis of modern medicine and image data. Perform symptoms of drugs, perform gasification intervention in the internal and gaseous centers, spleen and stomach, for gas exchange mechanism to enter and exit the lesion, quickly curb the diffusion and metastasis of cancer cells, and directly destroy mutations of mutant cancer mutations. Cancer cell repair lacks mutations, and cells and cytoplasm cells make cancer cells reverse to normal physiological cells. Theoretical foundation, and quote, Qianyuanji Da, and quote, describes, and quote, it is the gas in heaven, the ground is shape, and the shape of evaporation will be made from all things. And quote, the principles, pathological phenomena, disease diagnosis, treatment and prevention principles, so as to quickly achieve the purpose of cure tumors through gasification evolution. A comprehensive cancer treatment plan has been formulated with unique Chinese medicine characteristics and innovative thinking.